You wake up in the middle of the night. Something feels wrong. A crushing pain spreads through your chest. Your breath shortens, and fear takes over. You reach for your phone, but your hands are trembling. If this moment ever comes, knowing what to do in the next 60 seconds could mean the difference between life and death. These are the 7 actions every senior must know to survive a heart attack, even when you are completely alone. Every year, over 800,000 Americans experience a heart attack. Almost half of them are above 60, and many are alone when it happens. But here's the part most people don't know. According to the American Heart Association, those who stay calm and follow proven emergency steps double their chance of survival. Today, you'll learn exactly what those steps are. Practical, science-backed techniques that can help you stay alive until help arrives. Let's begin. Tip 7. Prepare before it happens. Surviving a heart attack starts long before it happens. If you live alone, your phone should be your lifeline. Keep it within arm's reach at all times, especially beside your bed. Program 911 as a speed dial and make sure your home address is clearly written near your phone. During an attack, confusion can set in fast, and you may not even remember basic details. A small medical alert device worn around your neck or wrist can also make a massive difference, but only if you actually wear it. Nearly 30% of seniors who owned one weren't wearing it during their emergency. Lastly, share your medical condition with a trusted neighbor or building manager. Just one person knowing what to do could save your life. Tip 6. The power of cough circulation. When chest pain strikes, your heart may start beating irregularly, and you can lose consciousness in seconds. A temporary way to keep oxygen flowing is a technique called cough-assisted circulation, or cough CPR. Here's how. Take a deep breath, then cough forcefully from deep in your chest every 2 seconds. Each cough creates pressure that keeps blood moving to your brain and heart, buying you precious time. Medical research from Peking Union Medical College found that patients using this method stayed conscious for over 90 seconds longer, often enough to call for help or take medication. It's not a cure, but it's a bridge, one that can keep you alive when every heartbeat matters. Tip 5. Take aspirin correctly. A single aspirin can dramatically increase your chance of survival, but only if taken the right way. Aspirin works by thinning your blood, helping it move past the blockage in your artery. Here's the key. Chew the tablet. Don't swallow it whole. Chewing allows the medicine to absorb through your mouth's lining and reach your bloodstream up to 12 minutes faster. The ideal dose? 1 full 325 milligram tablet, or 4 baby aspirins. Keep a few in your car, kitchen, and bedside drawer. And if you already take daily low-dose aspirin, take 1 extra emergency tablet, unless your doctor has told you otherwise. Those few seconds could make all the difference. Tip 4. Sit up, don't lie down. Your position can either help or harm your heart. When symptoms begin, never lie flat. This puts extra strain on your heart and lungs. Instead, sit upright at a 45-degree angle, resting against a wall or pillow with your knees slightly bent. This position helps your heart pump more efficiently and keeps your lungs open. If you start to feel faint, gently lower yourself to the floor on your side. That prevents choking if you vomit and helps keep your airway clear. Loosen tight clothing and stay calm. Your focus is to make every breath count. Tip 3. Control your breathing. Panic is your biggest enemy during a heart attack. Rapid breathing starves your body of oxygen and sends your heart into overdrive. Use this technique called paced breathing. Inhale through your nose for 4 seconds, hold for 4, and exhale slowly through pursed lips for 6. This slows your heart rate and stabilizes blood pressure. A Mayo Clinic study showed that even a few rounds of paced breathing can restore rhythm and improve oxygen flow. Train yourself to use this daily. When the moment comes, your body will remember even if your mind panics. Tip 2. Unlock your door first. Most people call 911 immediately, but forget one crucial step: unlocking the door. Paramedics can lose several minutes trying to break in, and during a heart attack, those minutes matter most. So as soon as symptoms start, Unlock your front door, turn on all your lights, and if possible, leave the door slightly open. If you live in an apartment, call building security right after calling 911 so they can guide emergency responders. A simple act like unlocking your door could mean the difference between rescue and tragedy. Tip 1. The nitroglycerin rule. If your doctor has prescribed nitroglycerin, it can save your life, but only if you use it properly. At the first sign of chest pain, sit down immediately. Place 1 tablet under your tongue and let it dissolve naturally. Never chew or swallow it. If pain continues after 5 minutes, take a second dose. If it persists, take a third after another 5 minutes, but never more than 3 in total. Store the tablets in their original bottle and replace them every 6 months since they lose strength quickly. And remember, never mix nitroglycerin with erectile dysfunction drugs. It can cause a deadly drop in blood pressure. For even greater protection, chew an aspirin first, then take your nitroglycerin. A combination Johns Hopkins researchers say improves survival by more than 50%. A heart attack can strike without warning, but what you do next decides your fate. Print these steps. Practice them. Share this video with your parents, your friends, your loved ones, anyone over 60 who lives alone. And if you learned something new today, hit subscribe and turn on the bell, because knowledge isn't just power, it's survival. Be prepared, because your heart deserves that chance.